consolidation week and a lovely half term, and you're feeling relaxed and ready to get back into our last couple of sections of psychopathology. So we've looked at phobias, how we classify it, the explanations and the treatment. We now have to do the same for 2 other types of mental illness. Starting today with depression. Okay, so you might have some knowledge on depression. You might know a little bit about it, how we treat it, what the explanations are. You might not have any idea. Or you might have some misconceptions, which we will clarify in the coming lessons. So just to start then with our recap quiz, always wanting to go back over previous content. Like I said, the exam boards haven't published anything regarding removal of papers or removal of modules. And to be honest, now that they're looking to bring back, starting to do a phase delay, part of me thinks they probably won't. So we need to keep going, we need to keep chugging on, doing as much as we can to revisit that old content so that we know it really, really well. So I've got some questions here. You can pause this and test yourself or talk to other people around you. So it's a lot of true or false for this section. So schemas are not present at birth but developed during childhood. Ash found that when a dissenter broke away from the majority, conformity only dropped if he gave the correct answer. Aims are developed from theories and are general statements. The central executive integrates information processed by other subsystems. And lastly, Simonelli et al. Found an unusually high proportion of insecure resistant babies. So pause this now and then match it up to what you've got here. So we've got false, true, true, false, and false. Okay, so if there were ones you weren't sure of, because they do like a multiple choice, and these are the kind of questions you could be given for multiple choice, then direct where you need to go over. What's also great actually in the book is they have a multiple choice section in every pack. So it could be for your revision, you test yourself or you get somebody to test you, just that those questions aren't being neglected. Okay, so introduction to depression. That is where we are today. So we need to define what depression is, look at the characteristics of depression, and apply some real life examples using the characteristics. Okay, so the book does it differently. It does all the introductions first, then the explanations and the treatments, but I prefer to group them all into one. I think it makes more sense. So, what is the cause of depression? This is George. He used to have ideal mental health, but lately he started to feel really down, and his doctor has now diagnosed him with depression. What might have caused George to develop such an abnormality? Why is it that he isn't just upset, he isn't just feeling a little bit low, but he has been characterised as having depression? How do they differ? So what actually is depression? So if we go back to our DSM, so this is a critical manual that we'll need when we look at schizophrenia in year 13, and it's really important here. So these classify mental disorders looking at things like length of time the symptoms have been present and the type of symptoms that are present. So depression is a mental disorder, low mood, low energy, and the ones that we look at here are 3 of the most common mental disorders. So in 2009, so a long time ago now, but I wonder what it would be now actually. Proportion of the UK that suffered with these mental illness, 2.6% for depression and phobias, OCD for 1.3%. Now, I would be staggered if depression, especially at the minute, wasn't the highest it's been for a very long time. Loneliness and feeling really low and agitated and restless, not wanting to get out of bed, feeling like you've lost your self-worth. I imagine that is at an all-time high with lockdown. And it's making sure that we aren't just saying, oh, I feel really depressed today. It's not a thing. Depression is something that is a long-term disorder. It develops over time. It's not just one day you feel it, one day you don't. Okay, so there's a lot of things we need to distinguish. So our DSM-5, our manual, has recognised different categories of depression and depressive disorders. So it's not just a one-size-fits-all with depression. We've got different types. So major depressive disorder is very severe, but short-term. So you could have this after a bereavement, something like that. Persistent, so long-term, it's recurring. It used to be called dysthymia, but it's basically, it's been around for a very long period of time. People suffer from depression 10, 15 years, and it's obviously pretty life-changing. Disruptive mood regulation, excuse me, so childhood temper tantrums come under this disruptive mood dysregulation disorder. But I guess it's not just, oh, Billy's having a tantrum. It's, you know, a severe, long period of time, hours on end, that makes it more severe. And this is quite an interesting one. Premenstrual dysphoric disorder, so disruption to mood prior to and or during menstruation. So for some women, they have a horrendous mood irregularities, whether that's due to certain birth control or just, you know, their genetic makeup, that makes them more susceptible to this type of mood disorder. It's very similar to, if you think post-traumatic, what am I trying to think of? Pregnancy. What is that called? I can't remember. When you have a baby and you're I can't remember. Postnatal depression. Oh, there it is. Some women have it, some women don't. And it's because of sort of different genetic makeups. It's not just people are a little bit low on mood, a little bit low on energy, but it's quite severe for some people. So just like you did with phobias, you've got some case studies. I'd like to identify the aspects that are emotional, behavioural and cognitive when we talk about depression. So emotional, how you're feeling, behavioural, how you're behaving, and cognitive, how they are thinking. So pause this now, do that, and then come back and self-assess your answers. We've got Jessica with just putting each of those types of cases into those categories: behavioural, emotional, cognitive. Kristen here and Josh. So have a look, self-assess. Why is it that you maybe mixed up emotional and behavioural? They're quite easy to mix up. Oh, then if we had mini whiteboards, this is what we would have done. But you can do this at home. So sufferers of depression may experience which of the following behavioural characteristics? A, B, or C, or D? Oh, I put the answer at the end, that's why. That's really not useful. So maybe you could go through and do this yourself and then write down A, B, C, or D, and then come back and self-assess. So patients with a diagnosis of depression are likely to have which? Which of the following is a cognitive characteristic? Oh, and I haven't put the answers. Oh, wow, this is shoddy work, miss. Really shoddy. Which of the following behavioural characteristics? So how they're acting. I would say all of the above. Patients with a diagnosis of depression are likely to have all of the above. Which of the following is a cognitive? So all about their thought. So focusing on negative aspects of a situation. Right, to consolidate, pick the one that you struggle with the most. I imagine it's probably cognitive. Outline the cognitive characteristics of depression. Cheeky 3 marks. We're talking about 4 lines, if that, really. Just to sum up what you've looked at so far.